What can you do for rotator cuff tears that don't involve cortisone injections or surgery? Well, this is something I treat in my clinic every single day, and it responds beautifully to regenerative medicine. I like to use prolotherapy and ozone injections. I combine the two. We call it prolozone. It's a beautiful, all-natural regenerative injection therapy that helps to stimulate your body's own natural healing ability and growth factors in areas that are damaged and degenerated and arthritic. And shoulders respond really well. So our shoulder has the ability to go through so many ranges of motion that there can be so much wear and tear and stress on the ligaments that stabilize the shoulder and on our rotator cuff tendons. And those tendons come off of our rotator cuff muscles. There's 4 muscles, and they attach to our shoulder bone, and they allow us to move our shoulder. The most common area we see rotator cuff tears is in our supraspinatus muscle, in the tendon of it, and that comes and attaches right on our shoulder bone, and we'll see that it gets kind of worn and frayed and has some slight tears in it. And so as long as there's not a full thickness tear, and if there was, you would know because you would be a surgical candidate. Most people are not surgical candidates for rotator cuff tears. But what we can do is we can go in with this combination of prolotherapy and ozone therapy right into that tendon and just allow our body to restart its healing process and regenerative process by putting in an all-natural vitamin solution, using some dextrose, which helps to calm down irritated nerves and stimulate growth factors in that tendon. And then we can go in with ozone, which is an all-natural oxygen ozone gas mixture. We can put literal healing energy, oxygen, into that torn area and help your body have the energy currency, the ability to heal itself. So rotator cuff tears respond really well to prolozone injection therapy. It's one of the most common things that I treat in my clinic, and it responds beautifully. So if you have a rotator cuff tear, I treat them every single day here in my clinic in Tampa, Florida. Prolozone is a really affordable treatment. It's comparable to platelet-rich plasma in terms of its effects, but it's significantly less expensive. Most patients with rotator cuff tears need between 3 to 6 injections. We space them out every couple weeks. You might need a booster once a year depending on how bad things are and how much stress you put on your shoulder with doing your everyday activities. But it does respond beautifully well and helps you avoid surgery and helps you avoid toxic cortisone injections. So if you have a rotator cuff tear, then regenerative medicine with prolozone, it's a great option.